What's up, everybody? It's David. I'm your host of Highway to Health podcast. Thank you for being here. If you know anything about this podcast, you know I'm excited to celebrate the people and the organizations that are doing everything that they can. They are committed to improving access, experience, and outcomes for our patient population. That's why I'm excited to have Shaji Ravi, the CEO of Access Healthcare of Smarter Technologies, on the show today. You're going to learn a lot. They have a big, hairy, audacious goal in revenue cycle. We're going to learn more about that. Shavi, welcome to Highway to Health.
Thank you, David. Thank you for having me. Such a wonderful place to be.
Oh man, we're glad you're here. It's better when you're here.
Yeah.
So thanks for being here.
It's an impressive studio that you have. I'm so blown away with it.
Well, thank you for saying that.
Yeah.
It's been fun to have these conversations.
Yeah.
I come from revenue cycle. It's kind of my home away from home. And what excites me about revenue cycle today is what you guys are doing.
Yeah.
And we want to get into that, but we start every podcast the same way. I like to ask my guests, you're busy, you got a lot on your plate, personally and professionally, but we know how important our own health is. So
Yeah.
What's a healthy habit, mental or physical habit, that you've built into your day so that you can stay top of your game?
You know, it started 15 years ago. We have a close bunch of friends, 5 of us, and we did everything, right from sports to, going to hitting the gym. And as we got older, we realized that, things start breaking down. And, someone came up with this brilliant idea of let's get a yoga coach and let's do yoga every single morning. And my routine is we get together, 5 of us and the instructor, 5 in the morning, and do yoga for 90 minutes. And, mind and soul, that's like, the downside is post that, I take a nap for 2 hours, which probably is not very healthy. But
where's you at?
So I'm a nomad. I shuttle between India and Dallas. Chennai is home.
Okay.
Dallas is also home. So I spend 2 weeks in Chennai, India, and 2 weeks in Dallas.
Wow.
Yeah.
So do you keep up that routine no matter where you are?
Yeah. So when I'm in Dallas, I have to wake up at 5 because it's a routine that I got used to it.
Yeah.
And then I don't get a lot of time for nap when I'm in Dallas. So getting to the office. And so, that, routine is king, like everyone says. And
I agree
it's
with
good to
that.
have a routine like that.
I agree.
Yeah.
Something about doing it in the morning, too.
Absolutely.
Especially with your buddies. Like if you have 5 of you guys that do
Exactly. You keep pushing everyone. So we have the latest, what we're trying to do is to do a headstand for more than 5 minutes.
No way.
Yeah. So headstand, I think we are ranging around 5 to 6 minutes a day. It's very good.
What's the text message chat look like when somebody misses out, when somebody oversleeps? You give them a hard time?
Absolutely. So, when I'm in India, my work day starts pretty late in the day. So it's like 11 in the morning, which goes till almost 11 in the evening.
Okay.
So sometimes you go to bed like 12, 1 a.m.
Yeah.
But because of the routine, you still wake up for the yoga.
Right.
And that's where the nap comes post that.
Yeah.
That's
You'll
the
need
best
it.
nap you do.
Yoga would be outside of my comfort zone, but sometimes that's the best.
It is. You've seen little babies who can take their toes and put it in the mouth.
Right.
A lot of people say that if you can do that as you grow as an adult, that shows how flexible your body is. So, literally saying you can put your foot in the mouth and it'll be okay with that.
That's a good test. You want to try it? I'm not. I'll expose myself. I appreciate you sharing that. I think it's important for people to understand, like, we're all busy.
Yeah.
But health is wealth. And without your health, especially now that I have kids and I want to stay active with them and I want to be there for their kids and their kids' kids.
Absolutely.
Health is everything. We've got to find a way to put ourselves as a priority.
Yeah. And your body is like an early warning. It gives you early warning signals if something is going wrong. And if you're just stationary, not doing anything physically, it never gives you any signals, right?
That's right.
Till it's late.
Too late.
Yeah. So it's very important that you maintain that routine of, playing a sport, hitting the gym, or doing yoga or something where there's always a message that your body is trying to tell you.
Yeah.
And
you got to give it a chance to tell you the
absolutely.
message.
Yeah.
And I think if we do our job personally, if we take that responsibility seriously, it'll take some pressure off the health system, which the health system badly needs right now.
Absolutely.
I mentioned in the intro this big, hairy, audacious goal that you guys have.
Yeah.
And, I was down with a company called Omnicell, and they have what they call the automated pharmacy.
Mm-hmm.
And they're talking about this touchless experience to get the medicines to the right place, to the right person at the right time.
Yeah.
When I was getting ready for this conversation, that's what it reminded me of, because y'all have a big goal.
Yeah.
And you're making some awesome improvements. For those that haven't caught up on what Access Healthcare and Smarter Technologies is doing, give us an overview.
Sure. I'll maybe start with my journey into healthcare.
Yeah.
And it really started when I got out of college in India. It's a very interesting story. There were a bunch of anesthesiologists out of State College, Pennsylvania, who came to Chennai for a yoga retreat. Again, there's a yoga involved. And, at the retreat, the only guy who could speak English, they started talking, and this is right when internet was happening, and people are talking about the possibilities that can be done with voice over IP, internet, the work that can be done remote. And one thing led to another, and we created a company called, at that time, where you would take the pain points at that time was a lot of effort goes into sending out claims to payer and sending them accurately. And this is, I'm talking about mid-90s where there were no EHRs. You had HCFA forms, and you would have 34 blocks of information that you would hand fill them. And, that's how I started my journey, where sitting and, doing claims entry onto the HCFA forms. And then once you double check everything, then you put it in an envelope and FedEx it to the payers and hope for the best.
Hope it gets there.
Yeah. And, 30 years of journey, what I've realized is what I used to do 30 years back, that's the same exact thing happening today. Healthcare hasn't changed much. You're still talking about 200 different denial codes, the claims getting denied. And when you go back and think about 30 years back, you started as, manually filling out claim forms to the amount of technology that has come through all these years. What has changed? You're still talking about the same pain points about health system battling with inefficiencies, over $250 billion a year that is wasted on claims that are not submitted properly, human errors, or claims that are getting denied. So I've seen the industry evolve in the last 30 years, where you're doing manual entry, and then the era of EHRs and EMRs that came that improved the processes. Then there was a phase in the last 10 years where robotic process automation came, and you're trying to automate the smaller things. And last year, so we started Access Healthcare in 2011, grew up to 27,000 people in India and the Philippines and the US. That's a lot of people to manage. And we had all the automations on RPA, but last year we hit a glass ceiling. And it was all about, this is all you could do to automate things, but that's not driving the results. Gotcha. And the results is primarily, the way I see it is, healthcare is, as you would know, there's so much knowledge that goes into how a claim gets generated to the amount of claim that gets adjudicated, gets denied or paid. The rules keeps changing. This is the only industry where the payer rules, the way the reimbursement processes keeps changing. And what we rely on is humans to understand these change in regulations and adapt real time and adapt and do their best to get these claims paid. And, sooner or later we realize that unless you are talking or looking at AI as a solution, where, you're taking the most repetitive task and, managing the business rules, managing how a claim is denied, and extrapolating that one denial into thousands of similar claims and fixing them, which it's not humanly possible.
Right.
So if we are a team of 5 people sitting and working denials, all 5 of us would have different ways of doing things and getting that paid. But when you bring in AI, you're actually simplifying everything. You're saying everything can be managed in knowledge streams that can react to every single denial and give you a single fix that can go back right to the front end and fix all claims for you. That's a lot, I know.
It's a lot. But has this been tried? I mean, so we hear AI all the time, and we have for the last few years, right? But what makes this different?
So what makes this different is smarter technologies. Brought in these 3 companies. Access Healthcare, which is, the whole human delivery aspect of it. We have 27,000 people working in US, India, and the Philippines. And then Smarter DX. Smarter DX is focused on clinical, front-end functions. And the third is Thoughtful AI, which builds agentic AI processes. Okay. And we brought these 3 companies together where we said, let's simplify the whole process. Every solution doesn't have to be where the CFO has to take a decision about how many bodies do I throw at this problem to fix these claims that are aging, they're not getting paid. You don't have to have a human solution for that. You have to bring in technology that works real time, that works intelligently, and that looks at the broader picture and gives us solutions real time.
Because that's the old way of doing things, right? I had a VP of revenue cycle one time say, I can't be a body shop anymore.
Yeah.
And because that's the traditional way of doing things is we have more claims, we have more denials, we have an aging AR, we just need to throw more bodies at it.
Absolutely. David, what baffles me is that, and you've been in the industry, if there are 100 claims that you're sending out every day, for example, 60 claims will get paid in the next 30 days, right?
Right.
And the problem is really with the 40 claims that are never getting paid. You need to follow up. You need to have someone check on it and figure out what's going on with these claims. Now, these 40 claims, do we truly have the energy and time and people to follow up? The answer probably is no. Yeah. So what most of the health systems would do is, out of these 40 claims, what's my priority claims? What are the high dollars? Right. What are the top 10 claims? Let's just focus on that. And what happens to the remaining 30 claims? That's written off over a period of time. So that's the loss of revenue that you don't want to throw bodies at that, because it's rising cost of people, not just in the US. Even India has double-digit labor inflations every year.
Really?
And you can't keep up to the increasing cost in healthcare. So you need a technology solution that would come and help you fix all of this.
Yeah, because they're operating on tight margins already.
Absolutely.
And with the rising costs of that employee, it makes it even harder for them.
Yeah.
Now, does it start with the denial and you work backwards because the denial is telling you where the error is? Tell me a little bit more about, the operational problem or challenge that you're trying to solve and how, smarter technologies, Access Healthcare, Thoughtful AI, Smarter DX are, changing the game in terms of, traditional RCM strategies or methods.
Yeah. So it as you know, we're dealing with front end, mid cycle, and back end, right?
Yeah.
So when you talk about front end, that's where Smarter DX comes in.
Okay.
Smarter DX is what it's doing is identifying opportunities that are being missed at front end for reimbursements. And Smarter DX is a bunch of smart guys who, these are PhDs who understand. Our founders at Smarter DX are physicians, doctors who have actually practiced. So they really know how crucial it is for the documentations to be done properly, how important it is for the CDI resource to make sure all the codes are in there, the claims are going correctly, the physicians and the hospitals are getting reimbursed for the service that was rendered. So when you clean up the front end, what it leaves you with is the mid-cycle and the back end. Now, when it comes to mid-cycle and back end, these are all we are focusing on building point solutions for every single process. So if you look at the whole revenue cycle process, you have coding, you have payment posting, you have denial management, you have AR follow-up,
right.
you have credit balances. And what we're saying is this is where most of the human energy is spent, where you have a team that's working to clean up all these issues. If you can clean up your front end, make sure that the claims are going right, and obviously your mid-cycle and the front end, the back end work gets reduced over a period of time in an ideal situation.
Right.
I haven't seen that in 30 years.
Yeah.
30 years back, I was working the phones, talking to payers, and it was the same denial reasons. This claim was denied for lack of medical necessity.
Yep.
And it's like, hey, why didn't we capture this in the beginning? Why didn't we do the prior authorization of when the patient walked in? Why didn't we talk to the payer? Why didn't we look at the eligibility of this patient before we sent out the claim? Why are we dealing with this denial 45 days later?
Right.
And, when you look at from an outside world, someone who's not in healthcare, some of my friends are, when I try to explain this, they say, this is so dumb. How can you guys not go back and fix the problems?
Right.
And the thing is, we're never able to catch up because what we're seeing is, nobody talks about this, but the payers are getting very smart.
It's an unfair game.
I think they are ahead of the curve in terms of deployment of agentic AI, artificial intelligence. I have seen over the last 24 months that kind of denials that are coming from payers. This is not humanly possible for a person to sit and adjudicate the claim and deny it. So it's clearly, you can see the pattern that they are using AI to deny claims. And, to be fair to them, they're doing it the right way. The intelligence is built, AI is looking at the claims that were received, and they're denying the claims for whatever reason.
So health systems have to match that. They have to match that strategy.
Absolutely. Health system is, I would say, at least 2 years behind payers to deploy AI. And that's where, the health systems and providers lack, because they're all trying to catch up to what payers are already started doing.
Why would health systems be 2 years behind on adopting a strategy like this? Is it because they're at more risk?
So if you look at traditionally, health systems are involved with running their infra, deploying their technology. They go through, EMR or EHR that is very expensive to deploy.
Right.
A lot of time and money is spent on some of those technologies. Now, if they have to innovate and look at AI solutions, that requires a lot of money.
Right.
And are health systems with their smaller margins, are they equipped to go and build technology that supports AI? Well, the answer is no.
Right.
And that's where we come in. Because of our expertise over the last 30 years in terms of all of the knowledge bases, all of the RPAs that we have exposed to, and the AI teams that we have within, we feel that we can create point solutions that health systems can procure from us without changing anything. They don't need to change their EHRs, EMRs. They don't need to, go through a big infrastructure implementations to accommodate this. Nothing needs to change. We would offer a bouquet of services where they pick and choose various modular services and deploy them. And, we feel that we can reduce their cost by almost 50%.
I want to get into that cost reduction. But that's something that, when I was in revenue cycle and we were proposing a solution,
right,
the first question we always got was, how much time, how much effort, how much lift is this going to require from my IT staff? Because they're strapped already. We don't have enough of them already, and they're busy on these 9 or 10 other projects that we have going. Is that something that y'all hear a lot?
Absolutely. And I think that's the biggest concern every time we go to sell our services, saying, hey, tell me, how much time and energy and people that would require for me to dedicate to this project. And our answer is always 0, So we're saying you don't have to have people trained in AI. You don't need to train your staff on AI. The modular services would work as a wraparound into your system.
Gotcha.
And that will help you improve the productivity, identify denials faster before they are denied by the payers, and fix your processes we call this root cause analysis.
Yeah.
Every single transaction an AI looks and recommends has a root cause analysis. And if you figure out what the root cause was, you are fixing thousands of claims every single day with one effort.
And you're doing that with the knowledge of it's going to change again. And so you're right, they're going to change the game on you again.
Absolutely.
And so if you get too far behind on this one because of your manual processes and review and analysis, you're just falling farther behind on the next change that they make.
Oh yeah.
So,
Absolutely.
Yeah.
So it's all about, like you said, it's all about how can an intelligent system perform in certain manner, yet be open to acquire new knowledge and change its processes like a self-learning module, and keep at it in terms of delivering the same transaction.
Is that the biggest difference? I get this question sometimes, the differences between RPA and AI. Is that the biggest difference between RPA and AI? RPA, from what I remember, is you're teaching a bot or, a mechanism to repeat the same steps over and over based on, how you train it. But AI is learning as it goes. How do you describe the differences between RPA and AI?
So RPA is, to simplify RPA, is like going to Microsoft Excel and creating formulas, and that formulas will generate graphs and tell you exactly what that data is.
Gotcha.
But RPA doesn't have the intelligence. If certain values changes in the spreadsheet, it'll just, this is garbage in, garbage out.
Right.
If you input certain thing, it'll give you an output.
Yep.
It'll just follow those formulas and steps and tell you what the result is. AI, on the other hand, is creating a learning module where it taps into your knowledge base and it says, okay, if I'm going to look at a claim that is denied for, again, medical necessity, what are the 5 different things that I need to figure out in this claim? And if the rules are changing, the knowledge management changes. So the AI is predicting, or not predicting necessarily, but acting on those revised rules and giving you the output.
Gotcha.
So there's a big difference between RPA versus AI.
AI is updating those formulas itself instead of a human having to go in and update the formulas in the spreadsheet.
Or it's saying, hey, this formula was updated. Why was it updated? The field value changed from 8 to 9. Why did it change from? It's asking those questions and learning why it changed and giving you an output. Whereas RPA, accurate output, better than us, right? Better than humans, because you can't remember everything.
Right.
Back in the days, you relied on your best biller.
Yes.
Linda has 15 years of experience.
Tribal knowledge.
It's all in her head. But how do you take that, and how do you make sure that Linda is 99% accurate with everything that she does? And that's where AI comes in.
I remember walking into these billing offices, and Linda would have her whole computer and desk covered with these Post-it notes.
Exactly.
Reminding her what to do when this happened.
Yeah.
And then you'd walk over to David's desk, and he doesn't have the same. He doesn't have the same Post-it notes.
Exactly. So we call them decision trees, where you're saying, if this is the scenario, these are the 5 things the decision tree for Linda is. But we're saying, let's standardize all the decision trees, and let's standardize how AI is giving us new decision trees based on the changes in Medicaid rules. Payer behavior. So the decision trees are not created by humans. AI is actually giving you a better decision tree, saying, hey, work these 5 steps and you'll be fine.
It's impossible to keep up with it. If anybody's sat in that chair, they know. Things change before you realize it. And next thing you know, 45 days later, you have a whole new batch of denials that you didn't expect.
Exactly.
And it requires a whole team, like a SWAT team, to go figure it out.
I have done that so many times when I'm working claims. And I remember going into the office on a Monday, working denials, come back on Tuesday, you're working the same denials.
Yeah.
Because someone is making the same mistakes in the front end, and nobody's fixing it. So, imagine the utter amount of wastage that goes into having a person do the same thing over and over again.
It's why these health systems are operating on 6% or less.
No, absolutely.
Of a margin. But you talked about modular solutions, and this is something that I feel like health systems worry about. They need a custom solution. Mm-hmm. They need a tailored solution because they'll tell you over and over again how unique they are,
right,
how unique their payer mix is,
yeah,
and why they're different than everybody else. But as a business at Smarter Technologies Access Healthcare, you guys have to scale these solutions to fit, the health systems nationally. How do you provide scale but a custom or modular solution for your customers?
No, absolutely. You mentioned this point about every customer feels that they're special.
Yeah.
They have their own intricacies. And
in their defense, they kind of are.
Yeah.
That's what makes it hard.
Yeah. So, but with our experience, we serve all the 50 states. We understand all the Medicare rules for across all the states. We understand every single specialty, if it's outpatient, all the single specialty, and everything that needs to go in for a claim according to that state law, the Medicare of that state law. When you bring all this knowledge together, you have more experience than a health system claiming that they know everything.
Right.
So that's where the differentiator comes. How do we take the best practices of everyone? You're in this battle together, right? You can't fight these battles alone. You're talking to the same payers, multiple health systems. Everyone's behaving differently. But if you have a unified response to fight this battle, and that is where we come in. And we come and talk about our modular services. A better example would be every function that you think within the RCM, like, for example, coding.
Yeah.
Coding, more and more there is a need for coders, stateside or even offshore. There's very little people getting into this business wanting to become coders. But how do you fix this? You have to go the automation way. You have to go the AI way. And you create that as a modular service. And you're saying, hey, if your coding-related denials were up like 20% last month, with this technology, that will drop down to 10% to start with. And that's a huge benefit.
Yeah. And that's where the cost reduction comes in.
Cost reduction, also the improvement in quality, because you're saying this is not humans sitting and doing things and making the same mistakes. It's technology that's actually improving every single day.
Learning with you. Scaling with you.
Yeah.
This isn't something that we've talked about yet, but I always like to ask this question because, 10 years ago, 15 years ago, it was, well, I'm worried about, global resources. I want my resources to be in, and we got over that hump, right? Yeah. And then 5 years ago, it was, I'm worried about artificial intelligence because I don't know what it's doing. I can't trust it, and we've got to be really safe with our data and those things. We're getting over that hump more and more every day. Why are we getting over that hump? Is it because it's out of necessity and these health systems have to find a way to do it, or is it just evidence that the technology has gotten to a point where it's safer, it's more generally available or accepted, and so it's common sense to go down that route for these health systems? Is it necessity or real improvement in the technology?
I think that's a very good question. I think all of the concerns every health system had before and current even today is everything is genuine, and it's valid because your concerns around data privacy, security of your data, you keep hearing about data breach that happens. Yeah. You have to take them seriously. This could get you out of business pretty fast. Oh, yeah. And what is changing in the recent times is how technology is evolved to give that assurance that data is safer with us. We have a huge offshore operation in India and the Philippines. None of our customer data resides in offshore location. So this data sits on the cloud stateside, and the user offshore is accessing the data and performing the work. Nothing is stored in India or the Philippines. Now, was this possible 15 years back? Probably not.
Right.
We had our servers there in India and the Philippines, and you had a huge data center. Right. Your data was sitting there. How secure is those centers? Yep. Can it be breached by hackers? Those were genuine questions. But technology has evolved to a point where you're saying, we are even telling our customer that don't even put them in cloud. Put them in your office. Yeah. We'll get in and access the data and work off it. and nothing gets saved. So I think technology is a big enabler in terms of how it's fixing most of these concerns.
Yeah, I think it's a little from column A, a little from column B. You talk to some people, some health systems and executives, and they're like, "What other choice do I have?" It's risky for me not to adopt these technologies.
Yeah.
Because if I don't, I can't hire enough people.
Yeah.
And if we can't get these my aging AR cleaned up and the cash in the door, I'm going to close down anyway.
Right.
It's almost like they have no choice.
Absolutely. And, I don't want to be in that position where you feel that you're taking a risk by doing certain things. But that is where, smarter technology comes, where we're talking about a technology solution where data is secure, data is at rest in the US, and the best is when we implement our AI solutions, we have the guardrails that governs all the, you're not having a rogue AI doing something on its own. Everyone talks about hallucination. That is where what we call the human in loop comes in. Every AI modular service is governed by humans in the loop, which means there are folks that are monitoring the AI, monitoring the changes that every single day AI is self-learning or recommending.
Gotcha.
It's approved by a human in the loop, which is saying, healthcare data is very important. You cannot let an application do things on its own.
Yeah.
And that could also get you out of business pretty fast.
Yeah, yeah. Do you think we'll ever get to a point where AI is moving so quickly and working so well that we can't keep up with that approval process?
Oh, yeah, absolutely.
Yeah?
So the implementation timeline for us, and I think we've seen this in even RPA days.
Yep.
When RPAs started, we had to have a control tower that governs all the bots because we don't want a rogue bot doing something on its own.
Right.
Yeah. You could easily have a programming error and a bot is totally doing something destructive and you don't even know about it. I think it's the same principles when it comes to AI, probably a little more, where you have to have the guardrails, the governance, and the humans in the loop, which is controlling. Everyone talks about how sensitive our industry is.
Right.
So you have to take that serious. Anyone who promises today that, I'll give you an AI solution and nobody needs to know anything about it.
Set it and forget it. Yeah.
Set it, forget it. You're in for trouble.
Man, there's so many funny stories about RPA back in the day where they had this routine running.
Yeah.
And they'd set it and forget that it was running. And then they'd get all these denials because you'd have, a male with pregnancy diagnosis codes or whatever, and they're like, where's this routine from? It's like, well, we implemented that a long time ago and we never updated it.
Exactly. Yeah.
And then it caused a whole nother problem. But
we call it a rogue bot.
A rogue bot. Yeah, I like that. There's probably a few of them out there still running.
Yeah.
And they don't even know about
scary.
it. Yeah, it is. It is. But that's kind of, I think that's the hesitancy around automation, artificial intelligence, because everybody has one of those stories.
Absolutely.
But there's better ways, and if your partner is truly a partner, they can help identify them. We've talked a lot about AI. The question I always get is, where in the revenue cycle, where in the chain is the biggest opportunity? I feel like we've always had a smaller team on the front and on the access, like patient access side of things, but that's where the majority of the errors are made, and then that affects everything downstream. So that's where we should, devote, our attention and our focus with AI. And then others say, only the dollars matter, and I've got to attack these denials with AI. Where do you see, the biggest opportunity?
I think you nailed it. It is in the front end. The example that I gave, if you're sending out 100 claims, 60 is getting paid in 30 days. You don't have to worry about that. But the 40 claims that were not paid, the answer is not about someone at the back end figuring out what went wrong. It's all ties up to the errors or the processes that were set wrong in the beginning. Now, that's where, Smarter DX within our organization comes in. It fixes that so that you have less people cleaning up the back end.
Yeah.
It sounds very simple.
It sounds like it, but we know better than that.
It's a very simple solution. everyone's been trying to do this for the last 30 years. But with humans, I think we just need to acknowledge that we were never able to fix this.
Right.
The amount of denials that are happening, you were never tying that back to the front end and fixing those errors. Some health systems did it well, but again, it's very dependent on individuals, how, revenue cycle managers who are very good at it, who create those processes, but then they leave. Then you're back to square one because you're still trying to figure a human solution to a technology problem.
When Linda retires, all that information goes with Linda.
Exactly.
Yeah. And you're hoping David catches up, and I'm not going to catch up.
No. It'll take you another 15 years to become a Linda.
Exactly. Hopefully she left her Post-it notes. I wrote this down because I heard you say it. Rev cycle, people often label it administrative, business office. I heard you frame it as more of a driver of sustainability and innovation for hospitals. What did you mean by that?
So, I'll probably simplify this because I'm exposed to India and the US. The Indian healthcare system, though it's not as mature as the US, the hospitals and providers get paid 99 times out of 100. And that's on time. Most of the time on the same day or within 5 days, business days. Even though it's not as efficient as healthcare in US, but do the hospitals and the physicians, do they not make money? They absolutely make money. Do they have healthy margins? Yes, they do. Are they as mature as the US healthcare processes? Probably not. But if I look at the US, it's a different ballgame, right?
Oh yeah.
It's your operating margins are so less. Your cost to collect is going up every single year. It's just the cost is increasing. It's not going to go down. Right. Your payers are finding ways to reduce the reimbursement rates. Yep. They're not increasing it. They're not adjusting it for COLA or inflation. That's not happening.
If anything, they go down.
The costs are only going up, and on top of that, your denials are not getting better. You are taking more time to collect, and you are dealing with more volumes of denials that you have to work harder to deploy people or technology to collect this. Now, how do you solve this problem? Because unless you step back and say that this is not humanly possible. Right. And I think that acknowledgement needs to happen. And that's where technology implementation and how you look at technology to help you guide this. Yeah. Now, 30 years of looking at the same denials, nothing has changed. It's still the same denials that are happening. Whoever figured this out in terms of how to fix certain denials? How do you know that this claim is going to get denied even before you send it out? Yeah, we're not there yet, and that's why we need technology.
You said health systems are probably 2 years behind where the payers are in terms of adopting this technology and then leveraging it for the good of their own business. Mm-hmm. I doubt we can ever close that gap completely, right? Because they make the rules.
Yeah,
and so we're always going to have to be reactive to how they are changing the game and how they are adapting. But 5 years from now, when more and more people are adopting and utilizing this type of automation and intelligence, where can we be?
Everyone needs a villain in the story.
Yeah.
And, for our part, sometimes I keep talking about payers, and it looks like I'm trying to make them the villain. They're not. They probably make lower margins in terms of some of the health systems around.
Oh, really?
Absolutely. And every organization has to be efficient in terms of what they do. And the adoption of technology is higher in payers. That's the ultimate truth. Everyone has to accept it. And it's for a reason. They're probably in the less than 5% margins business.
Gotcha.
Running a payer company.
Wow.
And so you're not talking about a greedy healthcare payer that's taking all the money and paying less to hospitals and payers.
This is a different stance than most take.
Yeah. So it's up to everyone to fix their own problems. And I think payers have realized I think they had a head start during the pandemic, where the deployment of AI was faster during that time. But if you look at a health system, it's a game between a CTO and a CFO. CTO wants to spend money and look at solutions to build, but CFO says, I'm already drowning here.
Right.
There's increasing costs, my margins are low, and I need a solution where I can't give you $1 million budget, where you'd go build something out. And I think that's the core area that we operate in. Yeah. And we are saying, hey, smarter technology will solve your problems, give you modular solutions, fix your problems, and yet reduce your cost by 50%.
With limited lift. Because that's the hidden cost that the CFO is taking into account too. Yes, there's a price for a partner or a vendor solution, but then they're also factoring in change management and the backlog that might accumulate while implementing a new solution.
Yep.
And when you start adding those things up, the cost of the CFO is multiple.
Absolutely. And that's where we come in with our experience of having 27,000 people who are working RCM. Yeah. We are saying, hey, day one, there's zero disruption. We'll take over your process. If the implementation of agentic agent takes, let's say, 6 months, those 6 months, I will have a human sitting and doing your work. I will have people doing this work. And then in 6 months' time, the agentic AI will be implemented. That will cut the number of people that is required by 50% in the first 3 months, 30% in the following 3 months. And eventually you have only a small team. And that team is only going to be responsible for governance, monitoring of the AI agent to ensure that, there are no robots. So
robots. Think about that. I mean, that is a drastic shift from where we were 15 years ago. That's why I'm excited having these conversations. It gives me hope because I know what challenges these hospitals are going through. And I also know that sometimes implementing a solution sounds like a bigger challenge. It's like the devil I don't know compared to the devil I do know.
Yeah.
And oftentimes these health systems go with the devil they know.
Yeah.
Because that might introduce, a new solution, a new provider, a new partner might introduce more problems or different problems that I don't know how to handle.
You're so right. I think that's why I'm so enthusiastic about our solution, is that you're not talking to an IT company out of Bay Area who probably doesn't understand healthcare. There are a bunch of guys wearing shorts and T-shirts running around building AI.
Maybe baseball hats.
Maybe baseball hats. You're talking to a company that has over 15 years of healthcare experience, has 27,000 people dedicated working on every single RCM process, understand every single state rules across the 50 states. We handle close to $200 billion every year in reimbursement. Over 200 customers, multiple health systems, 400,000 physicians. So you have our resume, which says, you're not a technology company out of SFO.
Yeah.
You're a healthcare company that's built, brought in the AI technology together, understands your business, and understands how difficult certain implementations could be. You're always fearing about, will this disrupt my cash flow? Will this disrupt my day-to-day? And we are saying there's be zero disruption. Our implementation is so seamless that, and you don't have to change any system. You don't have to train your people. It's just, as easy as it gets.
I mean, the company's track record says a lot, builds a lot of trust, credibility. I've got 2 questions left for you, because I think this will go along with that, that trust and credibility. Oftentimes when we bring different companies together, which is what you guys are doing with Smarter DX, Thoughtful AI, Access Healthcare, I've been a part of these, right, where you bring in these different solutions, and the goal is someday down the line, hopefully not too far in the future, we'll be one company with everything integrated and everything as one solution or as one company. That's a hard process to do. You guys have found a way to start integrating these 3 companies already, which I think should show some trust or build some trust and some credibility with your hospital systems that we can do this quickly. without much lift from you because we've already done it and we're doing it internally also. Talk a little bit about that.
No, I think this is a wonderful conversation, and we talk a lot about this. I think the key is mutual respect. And we know every single area of expertise that each company brings in. What Smarter DX does, I can't do it at Access. What Thoughtful does, Smarter DX can't do it. What Access does with 27,000 people, both Smarter DX or Thoughtful cannot do it. So it's a great marriage, It's like, your weaknesses. It's very complementary. We just baffled and amazed with the kind of talent that we have in each of these companies. And it's a mutual respect, right? I mean, we have a team from, Smarter DX and Thoughtful that's coming to India next month. And it's a big team that's traveling to India, spending a week. And I'm sure they're going to get blown away with the kind of talent, the knowledge management that we build, the technology that we built to operate our day-to-day functions, how we serve 200 customers on a daily basis. So it's only complementary, and there's a huge amount of mutual respect to each other's strengths. Yeah. And we know that our common goal is to work for health systems, improve their collections, reduce their costs. It's a very clearly defined goal. We are not talking about huge technology implementation. I run the Access Healthcare team back in India, 27,000 people, and we are a cost leader offshore. Okay. And I want to reduce cost by 50%. And I go to Smarter DX and Thoughtful and say, how do we get that done?
That's it right there.
And, I can literally, in the next 6 to 9 months, put my competitor out of the business if I can slash price by 50%. And see the impact that happens, because sooner or later you have to adapt to these technologies, because what we have done so far is not going to get us across the line. So
I heard, I believe it was the CEO of Smarter DX who talked about how bringing these companies together, it's not 2 + 2 = 4. Yeah. It's 2 + 2 = 10. Yeah. And, when you look at companies like Salesforce, one of those SFO companies that you talked about, that's their model. Yeah. They have Service Cloud, Sales Cloud, Marketing Cloud, right? They have all these modules. And when a partner brings them together, each one makes the other one better. Yeah. And so when you start bundling these, it's not 1, 2, 3 solutions = 3, the power of 3. No, it's when you make sales, service, and marketing better, your company becomes 10 times better. You're bringing that vision, have brought that vision, and that synergy, and that multiplicative. What's the word I'm looking for here? What's that word? Multiple. I don't know. Yeah. English major here. I'm still struggling. But it's exponential in terms of value to the partner.
Absolutely.
And you guys are seeing that benefit internally too.
And so that's the good thing about having a common goal. Our common goal is very well defined within the organization. What are we trying to do? We are not here to implement technology, implement people plus technology. Our outcome is well defined, is about how do we slash the healthcare cost by half. That's the problem statement that we're dealing with. If you're spending, let's say, $5 million on this, how do I get this to $2.5 million? That's the common goal. It's not about what you bring to the table or how cool is your AI, Agentic AI doing this. If the outcome is not translating to 50% reduction in cost, nobody wants to talk about it.
It's very true.
Yeah.
Last question. Somebody listens to this, they go home, they sit down with their family and they say, I learned this today. What's that one thing that you want the audience to hear and remember from our conversation?
I think it's going back to my personal experience. I've been in the industry for the last 30 years, started as a biller. I have seen industry evolve, and one thing is very certain is that change is constant. You have to adapt to changes, Every time you try to clutch on to your ideologies of doing certain business the way that you want to deliver, that changes, that gets outdated very fast. Okay. You have to look at technology as a solution for everything. how do we bring in the technology? What are the safer ways to do that? I think is where we play the game today. Is about how do we deploy technology? How do you look at? And I think I've seen it with, my kids using Chat GPTs and a lot of kids, right?
Yeah.
The kids are the fast learners.
They are.
They know exactly what's happening. Yep. They know when to get out of Instagram and get into another app, TikTok or whatever that is. They know which is better. I think we as adults need to see the problems as the same thing.
Yeah.
The solution, unfortunately, doesn't lie with humans solving problems. I think it has to be technology and humans coming together and solving problems together.
Well said. Thank you for being here.
My pleasure. Thank you for having me.
You're welcome back anytime. There's so much more I want to talk to you about. Thank you.
Thank you, David.